Hi everyone, welcome back to Pharmers Academy. So in this video, I'm giving you a little sneak peek at what our GMP for Beginners masterclass looks like. It is an applied masterclass, so you do have exercises and like a practical homework to do in the end to apply the work that you've learned, the information and all of the concepts, but you'll get to see for yourself when you enroll for the GMP Masterclass. Remember, this is a part of our GXP series. So we have a few other GXP Masterclasses available for those interested to pivot into the industrial sector of pharmacy and to start thriving as a brand new, fresh, off the books beginner. Okay. The first thing I'm going to say here is that I am currently an RP registered in South Africa. I'm Patricia. Ding. You probably all know me by now, but my GMP experience and expertise has come from both the manufacturing sector and the human medicines manufacturing sector. I was in complementary medicines for a little bit. I was in orthodox medicines for a little bit. I was in warehousing too. So, and now I consult as an RA pharmacist. So, but a good 6 years under my belt lets me tell all the beginners what it's like and how to come in. All right, so GMP, what is it? You hear GMP everywhere in industry and you're like, what is it actually? Well, GMP is a set of principles and procedures and practices that form standards which are appropriate for achieving quality manufacturing and to a product's specification. So think of it this way. If I want to create toothpaste, the GMP practices and procedures and set of quality standards that are going to go into the entire production pathway for me to achieve a high quality toothpaste is what GMP is. So in another way, GMP is a function of quality assurance. It's literally the foundation of everything concerning the manufacturing of a health product. Now, we often speak of CGMP being the current GMP, and this talks to the latest practices available to the industry. So you may have GMP with older procedures, processes, systems that may still be fine but slightly outdated as compared to latest innovations, or you could have CGMP, which is the latest thing on the market. So if a new process or a system software or even equipment comes out and you don't upgrade to that, you don't necessarily have to, but it just means you're no longer current. It means there's something that has preceded your practices, equipment, software, etc. All right, so that's the difference between GMP and CGMP. Very important to note is that CGMP really helps the product go beyond the regular standards. And that is specifically important when dealing with potentially dangerous products like narrow therapeutic index drugs or sterile medicines and things like that. Now, the whole purpose of GMP and CGMP is obviously to produce every single time a high quality product, so reproducibility and expected outcomes. But you have to understand key concepts of efficacy, quality, and safety. Those are the three grounding rules for which GMP exists. So your product at the end of the whole manufacturing process at every step needs to incorporate quality. So quality doesn't just appear at the end of a process. It has to be integrated from the beginning and at each and every step. Same with safety. You don't just check if the end product is safe and free of impurities or pathogens. You make sure that every step of the way the equipments are clean and avoiding impurities, the APIs, the raw materials and raw ingredients are free of them, so that at the end you're absolutely sure there is nothing in there. The same with efficacy. You don't just test efficacy at the end of the manufacturing process. You check efficacy from the get-go with the APIs, with their clinical trials, with the other ingredients or excipients in that product. So GMP incorporates all these concepts and parameters from the beginning right through till the end, so that your final product is A1. I also want to show you this iceberg here. Obviously it'll appear on the screen, but this is just to depict how big and wide and deep GMP actually goes. You don't really perceive it at first, but your equipment needs to be qualified, and your processes and procedures need to be validated. All that still anchors into GMP. The fact that you're cleaning your apparatus or your what are these cylinders or test tubes, the fact that you're cleaning them with a specific solution in a specific way also needs to be verified. How do you know that the outcome of the cleaning is what you desire? How do you know that there are no longer traces of microorganisms or dirt or impurities or bacteria, whatever the case might be, on the equipment or on the glassware or on whatever surface you need to have sanitized or you need to have sterilized? So it goes deeper and deeper and deeper. You have grading of facility air, just to give you a little hint on the intensity of a sterile facility. Like, the air quality needs to be controlled and checked. So it really goes down to the nitty-gritties to ensure that the final product is absolutely sterile and will not give you any issues. It's not going to be the source of contamination or introducing contaminants into the person's body, the patient ultimately who's using this product. So another thing I want to touch on concerning GMP is obviously the 5 P's of GMP. This is the crux of GMP, or at least the entryway by which you dive deeper. You'll hear the 5 P's of GMP and more, but to begin with, you need to know that there are 5 P's of GMP, and these are the people, the product, the procedure, the processes, and what's the last P? The premise, the facility. Okay, so once you know that, it kind of gives you bells that ring off in your head as to what you need to focus on when considering GMP. Remember, these are standards, so you're starting to think, what are the standards of the people I need to employ that are working with this product? So your staff, your pharmacists, your assistants, your quality assurance specialists, etc., etc. What is the standard for the premise the material, the build, the compartments, the spaces, the rooms, the flow of equipment, flow of material, flow of people, the air quality, the water quality, everything like that. You start to think, what is the standard for the product? What is the specification of this product? Does it need to be sterile? Does it need to not be? Does it need to be packaged in a glass bottle? Does it need plastic? Does it need whichever manner of sealing? Does it need I don't know, blister packs? Does it need whatever? Is it pink? Is it blue? Is it yellow? Does it have a flavor? Does it have, does it need to be reconstituted? Does it need to be crushed? Does it need to be swallowed, chewed? What are the specifications of this product as how the final user, the patient, will need to identify it, so that when you make it, you can compare it to your initial specs and see if it actually met those standards. And then you think of your processes and procedures. What is the standard of processes that need to be in place here? Do you have documentation? Who manufactures these medicines? Is there a batch manufacturing record, an instruction sheet? Do we have systems in place to ensure that the product can be manufactured consistently, reproducibly at the same standard every time? And then with the premise, the last P, again, like I said, you have to check your installations, your air, your water, your premise, the materials used, your surfaces, your functionality, the fitness for purpose of the environment, and all the sanitation that goes with it, the pest control, the cleaning, the safety, security, access, doors, everything. So the premise needs to also be guarded well so that it is suitable for GMP and ultimately for the end health product to be of good quality, safety, and efficacy. So those are the 5 P's in a nutshell, but more in the masterclass. These are some of the things you start thinking about when you are into quality assurance and into GMP. So you start looking at things differently. Your eye starts catching things differently. Your intuition starts analyzing and interrogating things differently. You look at a product and then things go off in your head. Has this been checked? Has it been released? Has it been quarantined? Has it been tested? Has it met the parameters that we've set for it? All these questions and analyses are functions of what GMP critically stands for. Okay, and to finish this off, because I won't be long, you know, a teaser is supposed to tease and not give everything away, but I will say this. GMP is also a set of guidelines, and we set standards, concepts, and these are ruled or enforced by certain authorities, right? Because who sets these standards? Who decides on these guidelines? So we have worldwide authorities like PICS who help to harmonize the enforcement of GMP and the standards of GMP across board all around the world in all member countries. And fortunately, South Africa is a member of PICS. So that means they get to abide by the guidelines and the recommendations of this authority. You also have regulatory authorities like the EMA, like the FDA, like SAPRA in South Africa, that do pitch in and set guidelines and standards to help contribute to these international guidelines and standards. So if you're practicing in South Africa, you will refer to the GMP guidelines for South Africa first, and then foremost to your international clients appeal. You will then also look to international GMP standards, which tend to be a little more stringent or a little bit more developed. SAPRA has done a fantastic job in coming up to speed with some of the latest regulations and regulatory needs of the past 5 years, I would say. And they've done a really good job at that, but they are still in the development of certain guidelines and making them even more specific and precise. So when in doubt, pick up your phone and call them. Email them and ask for assistance and further guidance. They have multiple departments available to help you in this specific area of concern, and they're just overall a good resource to look to on their website, on their e-learning platforms, and where they post a lot of their communications to industry. So I hope this helped. I hope this teaser was enticing enough. We look forward to enrolling you in our brand new GMP masterclass this 2025 and beyond. And we'll see you soon. Until then, stay farming.